Angela Richardson.
Thank you, Madam Deputy Speaker. It's been a rather sombre debate this evening, and the subject matter is very serious, but I hope the House doesn't mind if I inject a bit of positivity for the next 4 minutes. Yeah. I want to start by highlighting the enormous financial package that has supported businesses, organisations, charities, arts and culture. A package that has sustained services run by our local councils and that has helped our health providers continue to care for us. In my constituency of Guildford, over £92.5 million of bounce back in business interruption loans have been taken up so far. The ability to furlough staff and take advantage of the self-employed grants has been lauded by everyone I've spoken to, and I'm pleased the Chancellor has extended furlough and announced the doubling of the self-employed income support scheme today, as we look to implement national restrictions to help support our NHS and save lives. MHCLG has been generous in its support for my two local councils, with funding so far of over £1.8 million for Guildford Borough Council and over £1.5 million for Waverley. These figures sit within the generous support at county level to deliver their statutory services too. Rough sleeping has been an issue I've been focused on locally, and the several tranches of funding for this, including the recent £770,000 for long-term accommodation as the days get colder, is hugely welcome. The Royal Surrey Hospital received £500,000 to prepare for winter, and well prepared they are under the excellent direction of Chief Executive Louise Stead, with a new 20-bed ward specifically for a second wave of the virus, and medical professionals who have learned much during the first wave that will benefit patients in this autumn wave of cases. I could go on because the support has gone on and on. But, Madam Deputy Speaker, it's important to recognise the fact that we were already well prepared in Guildford, Cranley and our villages for the impact of lockdown earlier this year because we had in place a thriving voluntary network. These volunteers, like Voluntary Action South West Surrey, Cranley Street Champions put together by the Chairman of Cranley Parish Council, Liz Townsend, with support from many who continually volunteer in Cranley, must be recognised. The response to my Unsung Hero campaign was heartwarming. Debbie Foster in Fairlands received over 25 nominations for mobilising volunteers. Adrian Whitehead delivered 100 medical prescriptions a week in Fairlands from his mobility scooter. Special recognition must be given to Nick Wishner and his wife Charlotte, who run the Guildford Fringe, for their drive to pull together excellent online comedy shows and live performances to bring the community together in fundraising efforts for the Royal Surrey Hospital Charity and the Wish Foundation, which works to make arts accessible to everyone. These Facebook Live events were very successful and well supported, and I see Guildford Fringe have already adapted quickly and have moved a performance online for the end of this week. Siobhan Fox and Scott Kerr, both pilots anxiously waiting to hear what would become of their jobs, put their own worries aside to serve refreshments as volunteers at the Royal Surrey Hospital. During lockdown, there was fantastic and incredibly helpful cross-party engagement. We work well when we work together, and that was my experience. It's the best way to deliver quickly for residents. Hope is so important right now. There is fatigue, there is anxiety. We are concerned for those we know and love, for their jobs, for their mental health. We cannot ignore any of these issues, and we don't, because this government and all of us in our communities are defined not by the easy times, but by the times when we have to dig into those extra pockets of reserves we never knew we had, and keep going and keep fighting and not giving up. I pay tribute to the incredible energy and courage of everyone involved in tackling this pandemic, including my Right Honourable friend, the Secretary of State for Health, all the health ministers, our Chief Medical Officer, his deputies, the Chief Scientific Advisors, and those working at all levels of our NHS for the work they have done and continue to do for us all. It truly is a national health service, which is why it's right now to introduce national restrictions to make sure all health needs can be cared for. Yeah.